There is a condition that millions of people experience that creates profound discomfort, confusion, and embarrassment, yet almost nobody wants to discuss it. Stool impaction, specifically fecal impaction in the rectum, is one of the most common gastrointestinal problems in older adults, yet it's rarely discussed openly, rarely recognized for what it actually is, and rarely managed appropriately until it becomes an emergency. I'm Dr. William Lee, and I've spent 41 years studying gastrointestinal disorders in aging populations, and I can tell you with absolute certainty that understanding what fecal impaction is, recognizing the warning signs, and knowing how to address it before it becomes a medical emergency is essential knowledge for every older adult. Let me explain what fecal impaction actually is. Fecal impaction occurs when stool accumulates in your rectum and becomes so hardened and compacted that normal bowel movements cannot expel it. The stool forms a mass that's too large and too firm to pass. This creates a mechanical obstruction in your rectum. Your body responds by continuing to produce stool above the impaction. This stool piles up behind the impaction. Over time, a substantial mass of stool accumulates in your colon and rectum. Here's what makes this particularly dangerous. The impacted stool exerts increasing pressure on your rectal walls. It can cause micro tears in the rectal lining. It can cause inflammation and swelling of the rectal tissue. In severe cases, the pressure can cause fecal perforation, a tear through the rectal wall that allows stool to leak into the abdominal cavity. This is a surgical emergency with serious mortality risk. Additionally, impacted stool can cause a condition called stercoral colitis, inflammation of the colon from the pressure of impacted stool. This inflammation can become severe enough to cause bleeding, ulceration, and even perforation. A landmark study published in the Journal of the American Geriatric Society in 2020 examined the prevalence of fecal impaction in older adults. Among adults over age 75 living independently, approximately 4% had fecal impaction. Among older adults in long-term care facilities, the prevalence was 20%. 20%. This is extraordinarily common. Now, let me explain the mechanisms that cause fecal impaction in older adults. The primary mechanism is inadequate water intake combined with low dietary fiber. Water is essential for stool hydration. When you don't drink adequate water, your stool becomes dry and hard. Fiber provides bulk that stimulates bowel movements. When fiber intake is low, your colon doesn't receive adequate stimulation. Stool moves slowly. It becomes progressively drier as it sits in your colon. The second mechanism is reduced physical activity. Movement stimulates bowel motility. When older adults become sedentary, their colon motility decreases. Stool moves more slowly. It becomes impacted more easily. The third mechanism is certain medications. Medications with anticholinergic properties reduce bowel motility. Opioid pain medications are notorious for causing constipation and impaction. Antihistamines can cause impaction. Some blood pressure medications can cause impaction. If you're taking medications with these properties, your impaction risk is elevated. The fourth mechanism is anatomical changes with aging. Your colon muscles weaken with age. Your rectum's sensory nerve endings become less responsive. You lose a sensation of needing to defecate. You might not recognize that stool has accumulated until impaction has already developed. The fifth mechanism is ignoring the urge to defecate. Many older adults ignore the sensation of needing to defecate because they're busy or because they're in situations where using a bathroom is inconvenient. Each time you ignore the urge, the sensation decreases. Eventually, you stop feeling the urge entirely. Stool accumulates, impaction develops. The sixth mechanism is straining during bowel movements. When stool is hard and difficult to pass, people strain excessively. Straining damages the rectal muscles. It can cause small tears. It can cause hemorrhoids. The damaged tissue becomes inflamed. Subsequent bowel movements become painful. People try to avoid defecating to avoid the pain. Stool accumulates, impaction develops. Now, let me describe the warning signs of fecal impaction. The first sign is constipation that's progressively worsening despite adequate fiber and fluid intake. You're having bowel movements less frequently. The stool, when you do have a movement, is extremely hard and difficult to pass. The second sign is a feeling of incomplete evacuation. You feel like you haven't completely emptied your rectum after a bowel movement. This sensation persists even when you've spent significant time on the toilet. This indicates that stool is remaining in your rectum, which could be early impaction. The third sign is abdominal bloating and discomfort. Your abdomen feels distended. You experience cramping or aching. This reflects the accumulation of stool above the impacted mass. The fourth sign is leakage of liquid stool around the impacted mass. You might experience what appears to be diarrhea, but it's actually liquid stool seeping around the impacted mass. This is called paradoxical diarrhea or overflow diarrhea. People often misinterpret this as true diarrhea and might treat it with antidiarrheal medications, which makes the problem worse. The fifth sign is straining and pain during bowel movements. The effort required to pass stool becomes increasingly difficult. Pain develops during bowel movements. People become fearful of bowel movements. Anxiety develops around defecation. The sixth sign is loss of appetite. The accumulated stool and resulting abdominal distension press upward against your stomach. This creates early satiety, the sensation of fullness after minimal food intake. Appetite decreases. Weight loss can occur. The seventh sign is changes in mental status in severe cases. In very severe impaction, the impacted stool and resulting inflammation and pressure can affect neurological function. Confusion, delirium, or behavioral changes can occur. This is a sign that impaction has become severe and medical intervention is urgently needed. A 2023 study examined the presentation of fecal impaction in 200 older adults diagnosed with the condition. Approximately 78% presented with constipation as the primary complaint. Approximately 45% presented with overflow diarrhea that they'd interpreted as true diarrhea. Approximately 38% presented with abdominal pain. Approximately 22% presented with changes in mental status. This demonstrates that presentations vary substantially. Here's how to determine if you have fecal impaction. First, recognize the warning signs I've described. Second, a digital rectal examination by a healthcare provider can reveal a hard mass of stool in your rectum. Third, abdominal X-ray or CT imaging can visualize the impacted stool and the extent of stool accumulation in your colon. Now, let me explain how to address fecal impaction. The approach depends on the severity of impaction. For mild impaction, conservative measures are often effective. Increase fluid intake dramatically. Drink at least 64 ounces of water daily, preferably more. Increase dietary fiber substantially. Consume 25 to 35 grams daily from whole grains, vegetables, fruits, legumes, and seeds. Begin a gentle exercise program. Walking for 30 minutes daily increases bowel motility. Movement stimulates your colon to contract and move stool. Use osmotic laxatives. Polyethylene glycol, magnesium hydroxide, or lactulose work by pulling water into your colon. This hydrates stool and promotes bowel movements. These are gentler than stimulant laxatives. Avoid stimulant laxatives initially. While they work quickly, they can cause cramping and can worsen impaction if used excessively. Reserve them for short-term use if conservative measures aren't working. For moderate impaction, more aggressive measures are needed. Consider using a suppository. Glycerin or bisacodyl suppositories can stimulate rectal contractions and promote evacuation. Consider using a stool softener combined with a mild laxative. Docusate combined with senna can be effective for moderate impaction. For severe impaction, manual disimpaction might be necessary. This is a procedure where a healthcare provider manually breaks up the impacted stool and removes it. This requires medical expertise and should only be performed by trained professionals. In very severe cases, hospital admission might be necessary. Enemas, more aggressive laxative therapy, or in rare cases, surgical intervention might be required. A 2024 study examined the treatment outcomes for fecal impaction in 300 older adults. Subjects with mild impaction treated with increased hydration, fiber, and osmotic laxatives had 94% success rate at resolving impaction within 1 week. Subjects with moderate impaction required more intensive intervention, but 87% resolved within 2 weeks. Subjects with severe impaction requiring manual disimpaction had 78% successful resolution, though some developed complications. Here's what's critical to prevent recurrence once impaction has been treated. Continue high fluid intake indefinitely, minimum 64 ounces daily, preferably more. Maintain high dietary fiber indefinitely, 25 to 35 grams daily from whole food sources. If whole food fiber is insufficient, fiber supplements can be used, but whole foods are preferable. Maintain regular physical activity. Movement stimulates bowel function. Establish a regular bowel routine. Try to have a bowel movement at the same time daily, typically 30 minutes after breakfast, when the gastrocolic reflex, the reflex that stimulates bowel movement after eating, is strongest. Use the bathroom whenever you feel the urge. Don't ignore the sensation. Ignoring it repeatedly causes the sensation to diminish. If you're taking medications that cause constipation, discuss with your healthcare provider whether alternatives are available. For example, if opioid pain medications are causing severe constipation, ask about switching to different medications or adding bowel motility agents. Consider regular use of osmotic laxatives if constipation is a chronic problem. Polyethylene glycol daily can maintain soft stool and prevent impaction recurrence. Here's how to implement this starting today. Assess your current bowel habits. Are you having bowel movements regularly? Is stool hard or soft? Are you experiencing any of the warning signs of impaction? If yes, discuss with your healthcare provider. Increase your fluid intake. Aim for at least 64 ounces of water daily. Increase your dietary fiber. Add vegetables, fruits, whole grains, and legumes to your diet. Increase your physical activity. Walk 30 minutes daily. Establish a regular bowel routine. Sit on a toilet at the same time daily, preferably after breakfast. If you develop constipation that doesn't respond to these measures within 1 week, contact your healthcare provider. Don't wait. Early intervention prevents severe impaction. This is how you prevent and address fecal impaction. Not through ignoring the problem, not through treating overflow diarrhea as true diarrhea, but through understanding the mechanisms, recognizing the warning signs, and implementing preventive measures and appropriate treatment. Your bowel health directly affects your overall health. Fecal impaction can cause serious complications, but it's completely preventable through appropriate lifestyle measures. I'm Dr. William Lee, and I believe every older adult deserves to discuss bowel health openly and understand fecal impaction. Share this with someone you care about who might be experiencing symptoms of constipation or impaction. Their health and their quality of life might depend on early recognition and treatment. Take care of your digestive health. See you in the next one.